Hi everyone, my name is Rachel and I'm going to be talking about the findings of the Committee on the Cost of Medical Care. In the 1920s, healthcare became more difficult to obtain. Costs began to quickly rise so that even the middle class found it increasingly difficult to pay for care. Another issue that arose was the decrease of physicians in rural areas due to migration to cities. With these issues in mind, a privately funded commission to investigate the costs and distributions of medical care was formed in 1926. This group was initially made up of about 15 economists, physicians, and public health specialists, and was known as the Committee on the Cost of Medical Care, or the CCMC. The committee set out to focus on factual research and worked with the AMA, Metropolitan Life Insurance, and other private organizations to accomplish their goal. Within a 5-year period, the committee published 27 reports. They gave the most detailed information on American medical care of that time period. Some of their findings included estimates of national health expenditures and the first breakdown of the medical dollar. They also found that those with lower incomes were less likely to receive medical care and showed the unequal distribution of medical costs in the country. Ultimately, the main goal of the committee was to encourage healthcare reform. The committee attempted to be unbiased in the reports, but much of their data supported their agenda with a lack of data from the opposing view. For example, the CMCC stated that an increased amount of medical care would reduce diseases without considering other factors that affect illness, such as nutrition, housing, hygiene, and working conditions. The committee also did not include the effects of welfare programs within companies, nor did they discuss competition among medical plans. Overall, the CMCC supported reducing economic barriers to medical care, turning the power to professionals, and organizing medical care on a bureaucratic model. Its final report promoted group practice and payment, although it did not support compulsory health insurance. Instead, they proposed voluntary insurance plans while more group practices were being established. This was meant to protect individual practices during the eventual shift to compulsory health insurance. The CCMC reports were released in the AMA's journal in November of 1932. The AMA described the reports as radical, which showed the resistance against even voluntary health insurance. Franklin D. Roosevelt was coming into office just as this controversy took place, which led his administration to avoid the issue of health insurance. Health insurance is still a highly debated topic today in the United States, so I'll leave you with these questions. Do you think that compulsory health insurance would make a large impact on American health today? And what do you think the economic, political, and social effects would be of enacting mandatory health insurance?